I'm sure, Dr. Ritika, you see this every day, that we as patients, before we come in for any procedure, we have a tendency to go on the net and search about it and end up getting confused. Could you please lay it down crisply and correctly for us about what is refractive surgery all about?
So I think, see, there's a science behind refractive surgery, and we use various lasers, but these lasers have to be manufactured by companies.
Right.
And each time a company manufactures a device, they give it a name. So the same procedure gets multiple names because multiple companies manufacture it.
Right.
And therefore, this leads to a lot of jargon, which is a little unscientific and more industry driven. For example, the Lasik procedure, which was the most popular procedure for refractive correction, was augmented in terms of the laser delivery speed and the software that was used to measure the eye. Each time an upgrade comes, it's not, the name change is not as simple as iPhone 11, 12, 13, 14.
Right.
We keep it more complex.
Right.
So some company may call it Contura, others may call it ZY optics, some people called it custom view. So these were customized ways to do LASIK, but everybody was doing the same thing with a different name. Of course, some got better content on the internet, so the patient found that procedure to be more popular. But all the companies were upgrading to a similar technology to give similar results. However, what has happened now is that from LASIK or Contura or iLASIK or custom view or ZY optics, which is one generation of refractive surgery, we have moved to the next generation, which is a fundamental advancement in the fact that you no longer need a flap.
Okay.
A flap, once created, gives your eye an inherent defect that stays with you for life in terms of a slight weakness in terms of the strength of the eye. The new generation of procedures are lenticule-based procedures. This was started by Smile nearly a decade ago. Now these lasers have become faster and they cut more smoothly because the laser spot becomes smaller, the cut becomes finer, the results become better. So what started with Smile as a fundamental advancement a decade ago now is being carried forward by companies, and the latest advancement in this lenticule-based procedure is the launch of Silk. Silk does a similar lenticule correction, the differences being that the lenticule is shaped better, possibly cut better, and in a faster laser, that the focusing speed, accuracy and the rate of firing of the laser is better. So the procedure is getting advanced. The lenticule-based procedures are the future and actually the present as well. What started with Smile is today available as Silk and as Clear. These are not really names, they're all acronyms. And if you break down the acronyms, they're all scientifically talking about the same thing.
Okay.
But when you go on Dr. Google, the content is basically manufactured for the patient. And sometimes in order to simplify things,
right,
you oversimplify it in a manner that you cannot give a life-changing decision and full advice in 2 minutes, which is what you get of an Insta reel. So it needs to be deeper, and I would request that you speak to your doctor, that a lot of this jargon is actually very simple when you break it down scientifically. However, I would say that sometimes a doctor, when he invests in one technology, has greater experience in that technology and continues to market that technology or offer that technology to the patient. We at Center for Sight, because of our large network, have had the proud privilege to actually do the first ZY optics customized LASIK. One of the first in India was done here. The first femtosecond LASIK, iLASIK was in Asia, was installed with us. We had the privilege of doing the first Smile in the world, the single incision Smile at Center for Sight Baroda. And the first Silk procedure in a human eye was done at Center for Sight Delhi. So as the procedures advanced, we feel that one size does not fit all, and you need to basically cater technology to the perfect fit for the patient.
So has it ever happened with you, Dr. Ritika, that a patient walks in and says, I need to get this procedure done and I've researched about it, doctor.
Yes.
But when you actually sit and do their checkups and see their needs, you recommend them something entirely different.
It often does happen. I had one of my patients who was a university student in the United States of America, and US-based technologies are marketed more in United States.
Right.
So when I asked him, what are your hobbies? He said, I'm in the rugby team of my university. And he had heard about Lasik because it being developed in the United States was very popular there. And he insisted on getting that done. But when you're a rugby player, you are more predisposed to blunt trauma or physical trauma. And a lenticule-based procedure like SMILE, which at that time was very popular in Asia and Europe,
right,
but hadn't reached the United States,
right,
was the natural choice for him, because you want a stronger cornea. You're actually exposing yourself and throwing yourself in a rugby field.
Right.
So we actually gave him the information. The choice eventually remains with the patient, and he spoke to his ophthalmologist in the United States. Because SMILE wasn't launched there, the doctor was very skeptical, but then he spoke to enough of his Indian friends and undertook the decision to take SMILE, and we did give him enough information to support his decision, but it took a rather longish time, which should have been a straightforward selection. So sometimes Google clutters our mind and we have to first declutter it in order to give the right option to the patient. We also have a patient who sometimes have high cylindrical power, and they have friends who've gotten SMILE done. Right. Now SMILE is the best procedure for minus power, which is 80% of the people. But a high cylindrical power requires some degree of personalized treatment in terms of an irregular cornea is better corrected with contour-based procedures like Contoura, right? So that patient, because his sister had actually undergone SMILE, insisted on SMILE, but he had a cylindrical power and was a perfect candidate for Contour Lasik. So that is where one size definitely doesn't fit all, and you should declutter the mind in terms of a fixation on a procedure and let your doctor give you the best advice.
Follow Planet Lasik and post your queries to get answers from the experts.